Let's talk about the clinical correlation. So we have the L palsy and we have the Klumpke palsy. So this is the Erb's palsy is caused by the trauma during birth, when the woman have little cervical pelvic region. So when the mother have little pelvic region and the baby is trying to be pulled out from the pelvic region, it causes damage to the brachial plexus, to the supply, to the nerve, to the innervations of the upper limbs. And when they damage, you see a baby in which his or her hand is hanging by the side. So when you see a baby by which his hand, or you see a child or an adult right from childhood, his hand is hanging by the side, or it has a claw hand, is caused by this damage of the upper limbs. So one of the sign of the damage of the upper limbs is the waiter's tip position, and this is done when your baby, or when the hand is not able to move. The hand is going to hang by the side. It's caused by the damage of the brachial plexus, whereby as the woman or the medical inclined personnel are in charge for that day, as they are trying to pull out the baby from the womb or the uterus, they may be mistakenly damage the nerves of the upper limbs, and this will lead to the baby having one-sided arms, or the arms hanging by the side. So we have the Klumpke's palsy. The Klumpke's palsy is caused by the damage of root C8 to T1, while Erb's palsy is caused by the damage of root C5 to C6, and it leads to the formation of the claw hand. The claw hand is when there's damage in C8 and T1, and you see a hand, they have a claw hand because the C8 and the T1 has been damaged. The T8, it can be caused by injury, it can be caused by gunshots, it can be caused by so many accidents. So we have to be careful in whatever things we are doing. So we also have the winged scapula. You see a scapula having malfunctioning when the scapula is not normal from the way it's supposed to be, we say it is a winged scapula. So injury to the long thoracic nerve causes winged scapula. So you remember the long thoracic nerve is caused due to the formation of C5, C6 and T1 form the long thoracic nerve. So whenever there is injury to the long thoracic nerve, this means that root C5 has been damaged, root C6 maybe has also been damaged, and root 7 has also been damaged. So whenever the scapula is winged, meaning that the long thoracic scapular nerve has been damaged. So this is the mastery or the master summary of all the sections complete. So let's have our mnemonics, which is read that damn cadaver book. So recap, read that damn cadaver book. The read start from the roots, that starts from the trunks, dam starts from the division, cord starts from the cadaver, and branches starts from the book. So read that damn cadaver book mean you originate from the roots, from the trunk, from the division, from the cord, and from the branches. Mean root C5 to C6 form the trunks, root 7 continues to form the middle trunk, and root C8 and T1 form the inferior trunk. Now, as this results, it's now results to the anterior division and the posterior division, and this anterior division and the posterior division now fuses together to form the roots, just combines to form the trunk, while the trunk combines after they have divided to anterior and posterior region, now combine to form the cords. So the cords now further leads to the formation of other branches. So final takeaway, visualize the axillary artery, find the M formation, walk backward to find the lesion. Thank you for your time, and I recommend you to go and read Gray's Anatomy stroke Natal's Atlas on how to further this brachial plexus. Anatomy is the foundation of medicine. Don't forget to like, subscribe, and hit the notification bell for more videos like this on Sagacious Learners. Keep up. See you next time.